as the only lawyer on the panel, let me further perpetuate this myth. Well, it's not a myth, actually, the reality. One of the things that I hesitate to tell you, first of all, I haven't practiced law in some time, at least in a traditional sense. I am a lawyer, but I haven't practiced law in a traditional sense. I hesitate to tell you, because I don't think it's in my bio, what I used to do when I practiced law. I was a divorce lawyer. So if you think that you're unpopular in the pharmaceutical industry, you have no idea what it's like. Anyway, so that's why I don't practice law anymore. But moving on from that, what I'd like to speak with you about today is the challenge that patients face in communicating their needs to decision makers in government. I used to work in government, so what I'm going to talk to you about today is based on my experience. But as I was listening to Deborah, I was reminded of something that I thought that I had put out of my mind. And that is that a certain health minister, federal health minister, within the last 10 years, I won't name names, who publicly on more than one occasion equated the pharmaceutical industry to the tobacco industry. That's what you're up against. And so as I start to talk to you about patients communicating with government, remember they're hearing things like that from government, and some of them are believing it. And obviously that's a problem. So the scenario that I see every day is typical. A patient group or a patient enters into the healthcare system and lo and behold discovers that it isn't perfect, oftentimes around access to medications. Or a patient organization realizes the need to stand up and say something about an issue that affects their members. What do? Well, that's what I'd like to focus on under the theme of old principles and new tools. Challenge number one. Governments in this country are not designed to ensure that people understand how decisions are taken and why. I'm sure you're shocked by that. They do not sit down and say, now as we're drafting this legislation, hang on a second, let's make sure everybody can understand it. All right? Legislation is written by lawyers for lawyers. And even more, and it's even more difficult for people to comprehend. During the Bill 102 hearings a few years ago, as you may recall in 2006, the Ontario Legislature Standing Committee on Special Policy heard 99 submissions on the legislation. 99 submissions over 3 days, 10 minutes each. I was there and I reviewed every single submission in detail. Do you know how many of those 99 submissions were made by patients? Not patient groups representing patients. Patients. People sick. One out of 99. And our healthcare systems, which are large, complex, and at times disconnected, especially in pharmaceuticals, are overwhelming to people. Deborah mentioned that. The bottom line is, patients are meant to give up trying to bring about change before even starting, based on the complexities. The solution? Take the time to teach people. You can only communicate with someone about an issue if you have some understanding of it. You need to understand it yourself before you talk to somebody else about it. And you can only compel government to move in healthcare when you have some understanding of the systems that you're seeking to influence. You don't need to understand it as a patient in its entirety. And I always tell patients, never debate government on process and policy, because it's their process and policy. And once you figure it out, they'll change it. So never debate them on that. Patients aren't born knowing this information. They need to be taught it in such a way that they can be empowered to take responsibility and act. And I think all of us who know the systems, who do work in them, have an obligation to provide that knowledge to patients and caregivers on a daily basis in what I describe as a very respectful and patient manner. So how to even get started? Challenge number 2. This is the first question that I usually get asked in my work. How do I start? Followed by who do I talk to and what do I say and how do I say it? Some patients and caregivers face the challenge head on, but most do not. After all, many of them are sick. They're patients. Again, most people are more inclined to give up before trying. Other barriers that I've included, that I've faced, I should say, or encountered, are around language issues and cultural differences. But nothing compares to the inherent culture we have as Canadians as being far too polite. We don't ask questions. We don't stand up and say, Excuse me, decision maker, I think there's a problem. I disagree. Change the system. I think you're wrong. It's just not part of who we are as Canadians. And it's the biggest challenge I face in the work that I do. So solution, you need a plan. I mentioned old principles. Well, here they are around communicating for the purposes of bringing about change, as you can see on the screen.